But I did not opt for that. I have choose the medical colleges which are offering the diploma courses, and then I have choose the subdivisional hospitals, and then district hospitals and sub-district.
Hello, this is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist, and today we have Dr. Hema with us, who's doing diploma in anesthesia under NBMS, and she is in final year now. So today I would like to ask her to give you guys some tips and tricks before you enter your counseling session, because I know the counseling is going to happen in few days. So Hema wants to give you some advices, and even I would like to give you some advices so that you will be prepared for the counseling in a better way. So are you ready, Hema?
Yes, sir. First of all, congrats to everyone whoever are participating in the counseling. And I would like to tell a highlight thing that whether you get the seat you desire or not, just try to participate as much as you can in the counseling. And rest all, nothing is in your hands. So just give your hard luck and good luck in the counseling. That's it. So the result is like we can deal it later also. We can think about it. So first of all, just keep your all like ears and full sound mind into that, and then just do your counseling. Yes,
So,
sir.
so first I would like to ask you any tips and tricks you want to tell your juniors, because you are freshly finished your counseling last year.
Yeah. I would like to say one thing. I have got many questions regarding counseling, like tips and tricks and all, but it would be a very elaborative video. Like if I just started, it would be more than and as we don't have much time, I'll just say it in a very like simplified manner. Okay. Uh, First of all, don't think something you will get it, whom you will be getting in lesser rank or a greater rank than your corresponding rank. Okay. For example, if you have like a rank of 5,000, aim just 1,000 to 2,000 ranks. Don't go into the extremities. That one I would suggest you. For someone who would get a 30,000 rank, you should better know that mostly if you don't have any like category or something, you would not be getting MD seat in your like mostly like clinical branches. So try not to opt for it, rather than first focus on considering DNB better options, and then keep your luck into MD. Because what will happen is people just keep on clicking all the MD, MS, and then DNB. They feel like the order will be in that way. But you should also remember your rank. If your rank is above 35K, 40K, don't start from MD, MS, DNB, diploma options. You try and convince your brain saying that I am not going to get a MD seat. 40,000 rank and your OC, you'll definitely not get a MD seat. That is for sure. Like you can say, how can you like just check the previous 10 years, counseling ones. So you will know it. So what will be the benefit from this is if you only choose the diploma options which you have, that to prioritize your branch first of all. When you are not sure about a branch, just don't keep it in the counseling. That would add a more list to the NB side to just grab everything around. So you try to limit your options actually, so that in those better options you will get a best option. I have done the same thing, because while I was placing in the first counseling, I have kept it because in the first round it isn't unsure, like I'm literally unsure like what I'll be getting. I was even unsure of me getting a diploma of any subject also actually. But after I have kept it, I have seen a drastic, like similar change which has been occurred between my rank and my fellow ranks, and like just 5,000 to 10,000 up and down ranks. So what I have done is in the second counseling, as we had a chance of like if I just take a first counseling, if I get a seat, and if I take the seat and then go forward in the counseling, then I'm eligible to take the second counseling seat. Or if I don't like the one which I got in a second round, I could be taking in the first round. But the main thing what I have done is I have eliminated all my DNB options. DNB also, I'm including that. I have eliminated all the DNB options, all the MDMS options. I have chosen only diploma options. And that too, I was very clear about taking the branch, because I would not be taking ENT or Optal for sure. I thought about it. So my main aim was only anesthesia, and after that pediatrics. It was just up and down. I know that I would not get pediatrics. For sure, I know that I would not get, but still, I just kept that to first I prioritized anesthesia, and below that I have kept the pediatrics as option. And even in the anesthesia part, and I was like little bit concerned about where to take and all. I was actually thinking that maybe if I get in the same state, that would be more, good for me. But I did not opt for that. I have choose the medical colleges which are offering the diploma courses, and then I have choose the subdivisional hospitals, and then district hospitals, and sub-district hospitals, and then private ones.
Once more, can you tell the order? Huh? It is good actually.
Yeah. First, I have taken the government medical ones, government medical college where offering the diploma courses, and then subdivisional hospitals, and then district hospitals, and sub-district hospitals, and there are private ones like private hospitals, even like small hospitals. Actually, they are offering diploma courses, but there were only like 1 or 2 seats in them, like hardly 1 or 2 seats actually. So I feel like district hospitals are more better than private like small hospitals, because anywhere if you take the district is like government only. Even if you learn spinal, or if you learn like some or the other GA or blocks, you will definitely be learning very perfectly. And many people had questions of asking me whether will I be able to survive after diploma? Should I definitely do DNB? Do we feel inferior to it? Okay, I'll tell you one thing. I'm not saying to anyone that it is practiced everywhere. But the thing is actually, mostly if you get to learn spinals, to give spinals, if you settle down in some rural or semi-urban places also, you will earn a lot. So if you want a financial stability, you taking a diploma course, and that later you won't be studying much, or you can't be pursuing your DNB or something. So don't think that some private hospital will be good and you will get a CCU like training more in private hospitals rather than doing. But imagine if you are a diploma candidate, you can even settle down in a urban and semi-urban till you finish off your DNB, and you can earn money, and simultaneously you can get the degrees. But even if you can't give a proper spinal, or you can't even intubate a patient when it is emergency, nobody is going to give you a critical care unit job. That is for sure, because there are a lot of MD anesthetists also waiting for the job, and DNB anesthetists, and there are a lot of competition out there. And for CCU, there is a competition for us from the medicine side, who has done their MD general medicine, and also from people who has done their respiratory medicine, that is pulmonology. So most of the people are just doing the MD course, and then they are going into fellowship program of CCU, and then they are just joining the ICUs. So this is my opinion actually. So prefer going to district hospital. It's okay if they teach you even basics of this thing. But one thing is sure, they will be sending you to a rotation ship in a very higher medical colleges, at least for 3 to 4 months according to NBA. I don't know about other states whether they are sending or not, but in West Bengal, I have inquired about all the other district hospitals and subdivision hospitals. People whoever are doing diploma courses, they have told that everybody has connection with one or the other government institute, which is a higher one, and then they have this rotation ship. Even I'll be going to my rotation ship in just a couple of months, so that would be very beneficial. So I ask you to do only one good thing. Just sit down. I think only 1 or 2 days left for the counseling. I know it's a very last minute video, but still, hopefully, it helps you guys. Just sit down, just prepare your mind clearly that what rank you got, what is the seat you want to be allotted in, but what might you get. Always consider the negative options also. Don't just think that just keeping positively, it means that you will be getting it. No, sometimes luck doesn't favor us. We can't say even if we work hard or do whatever you have a good rank, luck doesn't favor to us. So sit down and write. If not this branch, what is the next branch which I'll be comfortable in? Because always remember, it's not about the place, it's about the branch you take. Because your branch will be your lifelong with you. The place you can be changing after 2 years or 3 years after you finish off your like diploma or degree something. If you're not satisfied with the place, just go explore. There is no problem in exploring, right? Once you get your degree, you will be confident enough. So even if you're not confident, I feel like at least you'll have something in your hand so that you'll not feel bad about yourself of not choosing a very like separate branch which you don't even like actually. It's like wasting your like one counseling doesn't matter, or maybe if you just drop it here and study for 1 more year, that doesn't matter. But if you take a seat and if you're unhappy, you will be in a very big dilemma of like 2 years or 3 years you have done a course, and then again for whole lifelong if you are not satisfied with it, that will be a very big mistake to consider. And many people are asking me between diploma, anesthesia, and pathology.
Mm.
The answer is same. The
Mm.
branch you have to choose.
Yeah.
Don't let counseling choose you. Okay, you choose the branch and you get it anywhere around the India. Try to go. I'm like, believe me, 2 years is like very less time. I don't even feel like I have finished my 9 months actually. And within 1 or 2 months, I'll go into rotation shift to other medical college. And within 3 months, if I just show you my schedule, like till January, I am like super busy. I can't even say, but still I'm trying to enjoy in between. So, I mean, those are the other matters actually which happen.
So one question is
So,
MD,
yeah, yeah, yes, sir.
sorry, MD anesthesia in private medical college and diploma in NBMS. I think
Mhm.
in similar rank person might get have an option of these things because
Yeah, but if somebody is getting, yeah, same that happened with me. If I'm getting MD anesthesia in a category, of course, like private A or B, something which is not management, and if you want to choose, and you're not even getting DNP anesthesia,
yeah,
should you choose diploma or not? Okay, one thing I'm telling you, if you're choosing any NBE course other than MD, from the very first day, you keep in your mind that this is not going to be easy. You
mm,
have to study, you have to work very hard, then only you will be cleared. This is the one thing I want to tell you guys. Even if you're happy or not happy hearing this, I mean, you have to study, work hard. It is going to be tough. I'm really telling you. And I have a good college. I mean, touchwood. I have a very good college, and my professors are. They keep on like asking me questions, and they keep on like asking us to present, and many things are going on. But if you get any other subdivisional or rural hospitals, this is not going to happen. They will just treat you as a laborers, that is for sure. Even here we are getting treated like PG shift is that is what a PG shift is
yeah.
actually. So you are just like a labor, okay? But you have to remember that the exam should be given by you. So your life is in your hands. So you can't see these all things I can't be telling, but if you are prepared to work hard, then only take the diploma course.
What
If
about
you just
district hospitals?
yeah.
Teaching is there. That is district, sub-district.
Uh, no, I have heard that there is very less teaching in district hospitals, like barely minimum. So that will be like everything will be depending on you only. Not only district hospitals, even in private hospitals, I have heard that they just say that they have few classes here and there, but I have never heard from anyone that there is a very consistent classes going on. But in MD, for sure, you will be having consistent classes and everything will be there. And even the pass rate will be very easy for MD, and you don't have to stress up much. So that is the one thing I want to tell you before taking MD or diploma seat. So if you guys are like, no, I can't take the stress. I have taken already enough stress, and I don't know what will be my life and all. If you are afraid of that, take MD seat. If you are like no, it's okay, I'll be getting motivated myself. Even I feel low sometimes. There is no like I'm not saying that I'm all the time I'm super happy and all these things. Even I feel low, but sometimes I try to make up myself because I just again remember all this. I'm a great overthinker, so for me these all like chalta hai a kind of thing. Okay, so just imagine and you being in that place. It's okay, overthink for 2 days, and then you will be having a beautiful life next after for 2 to 3 years. So don't worry, if you're not even getting sleep, trust me, it is very good. Don't sleep also during counseling. Pay attention, do it, and after that, once you get the seat, once you see your name, boom, that's it, everything is done. And many people are asking me, tell me about the good colleges, private institutes
Mm.
or colleges which are good, which are good.
I'll,
I'll tell you
you can
something.
tell, yeah, West
Just
Bengal.
as the as of the I have told you like the order, just place it in those order, and main thing, place it state wise. I know it is very tough. Putting the like ticks in the like counseling one is like not easy actually. I mean, marking the stuff is not easy. I know it takes so much of time, but sit there, like read all the points, like where it is there and like how many beds are there. I have heard that one app called Zyner. Like I think you have to be taking that subscription or something, and then you can just type your rank, or like you can see like how many beds are there in a college. I didn't take it personally, but my friend has taken it, and I have used it also during my counseling, just to know a rough calculation of how many beds are there, like what is the stipend actually, what is the bond penalty, and what will be like if I leave the seat and all. I have taken all this because I had a thought of joining a deemed college also. So just keep with Rajasthan. Many people are asking me Rajasthan. uh, I have heard Rajasthan, it's not that great from few people, and from few people I have heard that I'm happy with what I got. So my best suggestion is, nobody can tell you what is right and what is wrong. The same person in the same college might feel happy taking this seat, and the beside person, their colleague, might be very sad that he got this seat. So that is an individual choice. Even if I tell something now, even I feel my college is good for me, and maybe some other person might feel that is not that great. So it is an individual choice and individual thinking. So don't listen all of this. Just concentrate on which state you need, how far you can go from your hometown, and how often do you want to see your parents, and how much hard work you can do. And even if you get to the only spinal, be happy and try to learn from your all the other timings. Like don't waste your time. Maybe then you will feel like if you have more time, study, that's it. You don't have any other option. If you want to join and study, or if you want to drop this year and study, that will be in your hands. No, I'm done with this, I have little stresses and I have a good little bit of amount of money, I can pay it, then join IMDC. This is a very simple thing I want to say. Okay, just check for the states. West Bengal is really good because if you get in a very small district hospital also, you would definitely be getting many cesarean sections, and you'll be a pro in within like 3 to 4 months in giving spinals, all the hard spinals and everything, difficult spinals. And I have heard that there are more number of peripheral nerve blocks are also going in the district and sub-district level hospitals rather than in my medical college. We do get blocks, like on a rough scale of like 10 to 15 blocks per week or something. That's it. I mean, including emergencies and also electives I'm talking about. But I have heard that in other district hospitals, there are a lot of ortho and RTA cases where there are no nearby hospitals or areas are too far. So there they have n number of blocks. Like usually same, but comparatively, if you compare to GA, we do get a lot of GA cases, like same nearly like 10 to 15, something like that GA cases per week. So you will not be getting 2 to 3 cases also outside. So that one you have to keep in mind. Either one or the other thing you will be learning.
West Bengal, what are the best colleges if somebody wants to join?
Best colleges, in my case, like you can tag our college, like
Yeah.
for example, to say Diamond Harbour Government Medical College. And also, I have heard there is this Bolpur Subdivisional Hospital.
Mm.
It is also quite good. I have spoken. There is one Telugu guy there, and yeah, he said, yeah, he gets not. See, don't compare with a medical college, definitely. So whatever you get, like just try to correlate, and if you don't have it, also no need to worry. And Krishnanagar District Hospital is there.
It's good.
That is also good. Yeah, that is also good. And like few colleges only I have heard that they are good. That is the reason I'm not mentioning many also. And I don't know how much you will be able to search also. Because nowadays, when I was doing the counseling, yeah, they haven't even shown us the full address of the college which we got in a first counseling actually. They usually give the some a district hospital something, and I try to see from which place. And I didn't get a whole. I don't know. Maybe I did not even pay much attention because I was not
then it is pure luck.
So that is the thing.
But still, okay, no problem.
Actually, like, sir, I'm seriously saying it's like counseling is really not in our hands. I really don't know how this system is going on. But one thing is for sure, don't think that even if you don't get, also don't think you had a bad luck. Maybe that day or that moment it was not there. See, like for example, yesterday I got a cut in my hand, and like, am I like, is my luck very bad? No, right? But after that, whatever were happening are like very good. First time I have experienced anesthesia. I have got a like Actually, that was a very different feeling. Actually, that was a different feeling. So yeah, it's okay. Sometimes things happen. We just have to make sure that we are happy at any cost. That's it. I want peace. I want happy. Now you guys choose what you want. So that's all I can be telling you.
So take-home points would be have a focused selection profile, and district hospitals are good if your rank is above 30,000. And anesthesia is a good branch. We discussed it multiple times. And then West Bengal colleges are good. I think the district hospitals in other places are not so good. I think West Bengal it's better. I feel so based on what you.
Because actually the thing is there are a lot of cesarean sections. Like I mean, the population here that like I don't know, they go crazy about childbirth. I don't know why, and all this. So definitely you will get a lot of hands-on for LSES and everything. So that way I can at least assure you that you will be learning spinal very well. And even I have heard in from few anesthetists saying that if you can manage a very critical spinal is not just you just giving like block or just pricking the needle into a person's skin. It is a lot more than what you think. And there are still a lot of, okay, just to give an example, in the morning, like there was this hysterectomy going on, abdominal hysterectomy. Even my associate professor, he had to prick 3 times to get the CSF and the good block. So it is not that if you are even a HOD or like wherever stage you go, the difficult spinal is going to be difficult. When will you know how to manage it, or like what are the tips and tricks? That means like when you get more hands on, then you will be. It's not that if you give one spinal. Yeah, we had a lot of cases and a lot of things are actually going on. I don't have, I mean, even sir is like super busy. I can understand. So we can talk whenever, like next after you guys finish your counseling. But just try to take wherever you get it. If you're not able to leave the seat,
don't drop the seat. That's what we are trying to say. Don't drop the ear, basically.
Exactly.
Take some seat and do DNB after that.
See, even if you're, yeah, that is also very best option, sir. Even if you're not going to take the secondary MD, you can take the secondary DNB. That is a good option. Or if you just want to stop it here also, you can stop it. But it's not like other branches are not like that, because all of them are getting saturated. So I don't know about in other states, but in Andhra Pradesh, like seriously, sir, n number of colleges, like super number of doctors, and I don't know. If you want to get settled in a city, it is becoming tough actually.
Yeah, city is
even
tough,
for pediatricians or like anyone.
I did a video recently on saturation of anesthesia. You have to watch that.
Sure, sir.
The thing is, like anesthesia is not saturated according to me, but in cities it is saturated.
Cities definitely saturated. So because one person, if we are getting customized to that anesthetist, all the other surgeons are actually hospitals are calling. Even if they hear, hospitals are calling. I have heard from my own cousin. He is like, yeah, I'm getting calls from many colleges. I don't have time to go also. So he's like, it's like, see how much you have like that practical.
In
like
towns, demand
whatever
is more. Cities, saturation is there. In cities also, junior level you can get. In consultant, saturation is there. To become a consultant is very tough. To manage a senior resident is always a vacancy. Every hospital needs, even we will need, everyone will need.
Definitely. And one thing for sure, sir, in any emergency case, how to like catheterize a patient, like IV, cannula, or anything, like in emergency situations, I think anesthetist is the only person at like last everybody can like just get off their hands, and then only anesthetist comes and does everything. That's not that I'm not bragging that I took the branch. Actually, that is the thing. Even if I had taken medicine, MD general medicine, I would say the same thing. So it's like even in emergency medicine, there are some things like which are very different to anesthesia, and sometimes anesthetist goes and sees. Like as I have worked in a private hospital, I know the things. Like even if there is an emergency physician, actually anesthetist comes and checks the patient actually in emergency. So you will be trained for all the emergencies, that is for sure. So you will be like, you'll not have that fear or that thing like what will happen to the patient. Your mind will be trained in such a way. So anesthesia is a very good branch. You can be taking it, and you people might be a competition for us also. But I'm still happy that if you guys take anesthesia, that would be a very good branch, and you will be happy. Only one thing is like you have to study so much. You have to study so much.
Yeah, they will
That
study.
is for sure. Can't escape
All
from
our
study.
subscribers are very good actually. They will study in future and they'll become
Yeah,
prepared
I'm happy.
anesthetists.
I've been speaking to many people, and I'm really happy, sir. They're like still working actually. The
Mhm.
counseling is in 1 2 days, and many people are working so hard. And I wish this video will help them actually. All choose your state where you can go, how far you can go. Take your rank. Just sit down, write all the points and where you can be going and where you can take it. And next, even during counseling, don't simply mark all the options,
Focused.
see accordingly and more. Yeah, focused, only limited, keep it limited and fresh. Just
Got it.
imagine like even one up and down can change a lot actually. That you'll not be knowing the internal issues, but still, just try to take and keep everything. And diploma has no bond. Many people are asking me this,
Mm.
and even DNB doesn't have bond, and diploma doesn't have bond.
Only MD has a bond in some states.
Exactly, in some states. And there are states which have 1 year bond, 2 years bond, and 3 years, 5 years bond, and 6 years bond, and 10 years bond states are
Yeah.
also there. So see accordingly and go. And I really wish you all a very good luck for your counseling.
Yeah.
Don't
Thank you.
worry if you mess up in first round.
Uh,
Second round
One
should
more
be
thing I would like
very,
to tell, take in some other
yes,
state
sir.
days because staying in your
Mm-hmm.
own state, no, you will be still stuck in your comfort zone only. You have to come out of it, like how Hema did. She's gone to West Bengal. She's basically from Andhra Pradesh. In the same way, I think you should also come to Karnataka. I am from Andhra Pradesh now. I am settled in Bangalore. So like that, I think you should go to some other state and then explore. So there is no
No, the
point in
only
staying
thing
this.
I feel like is when you go to other states, you lose your fear actually.
Mm,
You lose your fear, you build more confidence.
yeah.
And by seeing like anyhow after 2 to 3 years you'll go and settle in your mother town, right? Like
Mm,
definitely for sure.
yeah.
So by the till the time you go to different places, explore different people, professors and everyone or your colleagues. Actually, if you join a diploma course for sure or DNB course, see many different people coming from different cities. When you talk to people, you understand life. You will know how to take your future path, and you will meet lot of people. You will know what to do, what not to do in further. So life will teach you many things. So always I say explore. Never feel like you will be happy sitting at your hometown. See, that is also not bad if you are a person who is very happy just being in a very different place. But if you're an introvert, I would literally suggest you to go outside, because if you want to practice anesthesia, it's all about you talking, like trying to grab your patient's attention. When you counseling also, counseling is a very important part while giving anesthesia or anything. Whatever happens intraoperatively, surgeon just lifts their hand. Sorry, I'm not saying anything, but definitely. And even post-op also, for 24 hours, I'm telling you, it will be under anesthetist only.
Yeah.
So
You're
you should know how
responsible.
to talk to your patients, how to talk to attenders, and how to talk confidently so that the other person will not have anything to say. These are just
Correct.
tips of managing. That's all. You will be learning it soon, and even I am still learning, and I'll be learning throughout my life.
Yeah, this
That
we'll
is
do
for
as a
sure.
one separate session. We both will do this how to
Yeah,
counsel.
sure, sir. And even I am feeling many people are asking like, what if we take anesthesia? Anesthesia is like very less. We haven't had any exposure in anesthesia during our internship or our UG. So how would you guide us, ma'am? And all like they were asking me.
Mm,
So I thought maybe by the time they get joined, I would be finishing my first year, like most probably within two to 3 months they would be joining. I think till the mop up round and everything. So when I enter, I think I'll become more serious about studying part also. Now I'm like so. I'm being frank. I'm not that serious. I am, but still. So at the time, I will try to make few videos actually, starting how to start, because as I'm very fresh and new, I will know the difficulties I have faced, and
mm,
I can share my experience so that you people can correlate actually. There is no much difference between the people who will be taking an, as I will be just entering into the second year. So I hope this video will help at least to some extent.
yeah,
And thanks so much to sir, because he's super busy and
no
still like
problem. Yeah.
he has arranged some time all you for all you people. So good luck. My best wishes to all of
Thank
you.
you, Emma, for guiding all the subscribers. And
Thank you so much, sir.
this video will help thousands of people. And
Hopefully.
yeah. And
If you
most of them will become anesthesiologists.
don't understand, we are literally in hurry. So just try to, watch video once or twice so that
Yeah.
you will know what are the important points you want to know, because
Yes.
we both are like in
Yeah.
middle of the work actually.
Correct. So then next we'll do
Thank you
on
so
how
much.
to prepare. Once you join, we'll do a video again. What books to study in the
Definitely, sir. Sure.
We'll guide them again.
Yeah, in the
Okay.
starting, or like first of all, how to approach to the TOT environment and everything.
Yes.
And yeah, definitely, sir. Sure.
We'll
We'll
do
be seriously
difficulties
possible.
faced in first year we'll do, and then books to read.
Definitely. Yeah. Sure, sir. Okay. Thank you so much, sir.